Apalutamide is another second-generation androgen receptor antagonist, similar to enzalutamide. It too has a chance of seizure. It too brings down the PSA. It too can shrink tumors. And it has not yet been shown to improve survival compared to placebo. Apalutamide has similar side effects to enzalutamide. It should not be used in patients with a history of seizure. It could possibly decrease cognitive function, could possibly increase the risk of falls, and I haven't mentioned it yet, but all these agents can also cause decreased bone density. There is nothing worse than uncontrolled prostate cancer. Every treatment we use to fight it has side effects, but compared to uncontrolled prostate cancer, they're relatively minimal. So then we compare the toxicities of the agents available to us. And drugs like apalutamide are easier for patients to take than chemotherapy and have much less effect on the bone marrow, fatigue, neuropathy. So I believe that the side effects are worth the efficacy that these drugs have. The Spartan Study looks at men with non-metastatic prostate cancer who have a PSA doubling time of under 10 months. It randomizes those men in a 2-to-1 fashion to apalutamide versus placebo and follows them forward in time for side effects, toxicities. They collect data on the PSA, but that's not known to the patient or physician. They check imaging studies every 4 months until the patient develops metastases. And the primary endpoint of this trial is metastasis-free survival, with secondary endpoints including time to next treatment and overall survival. The clinical significance of the Spartan Study can be very profound because we have quite a few patients in this realm of having non-metastatic castration-resistant prostate cancer, and we don't have many things to offer them. So the clinical impact is that we can use it and delay the time to metastases. So as a physician, my patients and I are very concerned when they develop a tumor on a bone scan or a CAT scan. And if we can possibly delay that, we could delay some untoward effects of the cancer and potentially, maybe by the Z article, prevent death or delay it. I think it'll have a very profound impact on the clinic. The approval of apalutamide will cause these AR antagonists to move forward in the treatment of prostate cancer. It could also move up chemotherapy and some of the other treatments for metastatic cancer. These AR antagonists being used earlier will also make it more difficult to give patients abiraterone because of the cross-resistance between these AR receptor antagonists and abiraterone. I can see us potentially using more chemotherapy.